Mercy Perrysburg Family Medicine, as we do the third Wednesday of each month, give a talk on a different medical topic. Today, we have the pleasure of having Dr. Kilminski with us, who is our family medicine resident, as well as Elena, who is our pharmacy resident. So they're going to kind of tag team this topic of constipation, and he's going to talk about things from a medical standpoint, and then she's going to talk about things from a pharmacy standpoint, either prescription meds or over the counter, or whatever's necessary to help keep us regular. So I'm going to turn it over to them. We'll stick around in case you have any personal questions.
All right. So I'm Dr. Kilminski, and I'm going to talk about the medical side of constipation. This is Elena, like Tony already said. She's going to talk about like the medicine side, the supplement side of constipation. So the definition of constipation is less than 3 bowel movements a week. Anything less than that, so 2 or 1 a week would be classified as constipation. Anything that would indicate like hard or lumpy stools, straining to go, or just not emptying your bowels completely is also constipation. And then any change from your baseline. So if you go from having like 3 to 4 bowel movements a week to having hard, lumpy stools once or twice a week, that would be classified as constipation. Why it matters. So constipation could be not only uncomfortable, but it could be somewhat dangerous. Could possibly lead to like bowel obstruction, etc., which could cause big issues in our older adult population. Other things it could cause: decreased appetite if you're not feeling well, delirium, urinary retention because of where the colon sits. It could compress the bladder, cause urinary retention, UTIs. Fecal impaction, of course, which would require you to go to the hospital to get disinfected, which nobody wants to do. So I'll briefly go over, there's like different types of constipation. A lot of it's kind of just fancy talk. So normal transit constipation is the most common kind. So normal frequency, but you're having really hard stools. There's slow transit, which is infrequent stools, a little less common. You get bloating and abdominal discomfort. There's outlet dysfunction, which is difficulty initiating or passing stool. And then there's secondary constipation, which is pretty relevant to our older adult population. This is due to medications, medical conditions like diabetes, narcotics like pain medications can slow the gut down. That's why after someone has a surgery, they're on pain meds. Our goal is to get them off pain meds as soon as possible. To make sure that they don't become dependent on them and they don't become, get this like a narcotic induced constipation. Other medications can do it: iron, antihypertensive, anti-blood pressure medications, etc. Other issues that can cause constipation: low fiber in the diet, not drinking enough water. So it's important that you do both. So you want to get fiber and drink a lot of water. So if you just eat a lot of fiber but don't have water, then that could cause constipation. So you want to make sure you're kind of doing both. And the goals of constipation management to obviously have regular bowel movements, to relieve any discomfort, especially impaction, to have at least 3 to 4 bowel movements a week is kind of the goal. So I'll talk about the non-medical management, then I'll turn it over. So this is kind of like say like common, I would say, scheduled toileting after meals, like having a scheduled time. I know it's hard, right? Because you gotta go when you gotta go, right? You can't really schedule that, right? So but allowing time and privacy to go. Positioning. So actually in other parts of the world, they actually have stools that you kind of prop your knees up when you sit. It's actually the optimal way to go to the bathroom, not sitting like a chair like we're sitting now. So actually being in that optimal position would actually aid in going to the bathroom. Having 20.
Can we ask questions as we go?
Sure. Yeah.
Okay. Is there a certain age limit where it kind of starts as you get in older?
For like more frequent?
I mean,
constipation?
you can have bouts of constipation every now and then all
Right.
in your life.
Mm-hmm.
But it seems like in the later years,
Mm-hmm.
and I know it's also on how you eat, what you eat, and everything else. And like you said, first big question I had was, what do they consider the right amount of liquid? And I'm talking about water, because I got hit before, juices, coffee, and all of a sudden it doesn't count as water.
Mm-hmm.
What do they say you should have a day?
I'd say at baseline, this is a rule for everybody on Earth. I would say 64 to 72 fluid ounces of water a day. So that's about 6 to 8 glasses of water. You know, a normal glass of water, we'll make it
Yeah.
simple, 6 to 8 of those a day. Would Probably be my would be my recommendation. Everyone should be drinking more water. I feel like people don't drink enough water. So
Well, that's
that's
true.
yeah.
Do you drink that much?
I try. I try.
So
Yeah.
I try.
Yeah.
Yeah.
Some days I'm sure I hit it. I drink a lot of fluids in general. So, you know, I drink, when I go work out at the gym, I'm sure I hit that because I'm drinking a ton of water. But in the mornings, I'm a little guilty. I'm a coffee drinker. So, coffee and energy drinks, but I try to up my water later in the day. So I do try to hit that goal. Yeah.
Well, I had told me one time 126 ounces.
Oh,
Wow.
Yeah.
Now they can do calculations to
Wouldn't
find
that
out.
be like a gallon?
Well, 126 divided by 8.
Yeah.
Yeah, money for. Well, that
about
goes
6 gallon in time.
Yeah, no, it's like two pints of
128.
too many.
Yeah, right.
I thought that
Look at
was
us.
roughly a gallon, and for me, I
It is.
didn't drink that much before, and all of a sudden I'm drinking that much,
Mhm.
and I was waiting for a goldfish to swim by, because, you know, you got so much in you.
Yeah.
Sloshing.
Yeah,
We have too much water too.
Yeah,
Oh,
yeah,
Oh, yeah,
you
you
could-
can, for
Yeah,
sure.
yeah, someone, I read there was a story, like a sad story, like 10 years ago, where this young woman was trying to win, I think, a game system for her kid. And she drank too much water and developed, like hyponatremia, and she died. She drank too much water, so,
Mhm. You can dilute yourself too much essentially.
yeah.
okay.
Yeah,
So,
and they can do calculations based off of, like, if you're a man or a woman, how tall you are, how much you weigh, to kind of find the right amount of water for you, but generally, we just recommend that 8 cups
Mhm.
that are 8 ounces each
Mhm.
to get there.
I think if you're getting 7 to 8 cups of water a day, I think
You're doing pretty good.
You're doing pretty good, yeah.
Better than probably the average American, if I had to guess.
Yeah. Yeah. Any other questions so far?
What countries do that, have their stools set differently? What in the world?
Oh, gosh, I would imagine,
Thailand?
that's a good question,
I
Thailand,
think Thailand,
yeah,
at least.
Thailand?
Yeah.
yeah.
See, like, before we got into houses and stuff, we would squat. And so that's the normal position for our body to be in. So when you have your legs propped up on the toilet, it helps get you better into that position.
Yeah, and my son sent me one of them stool things to talk about. two step.
Yeah, I was just about to say a brand name Squatty Potty.
Mhm.
Mhm.
And
Any other questions?
No, go
No,
ahead.
not right now,
Okay.
okay.
Yeah,
So I'll talk about like the non-medical stuff. So we talked about the footstool, and then make a squat while you're sitting, having an optimal amount of fiber. So that, again, this is diet, what you're eating. So whole grain breads, oatmeal, great, fruits, veggies, prunes, beans. And you want to increase this slowly through, you know, you don't want to have a low fiber intake and then eat, like, you know, a whole loaf of wheat bread tomorrow, you know,
yeah.
up it slowly. And then when you do increase your fiber, also increase your hydration. So we talk about the water intake, about 64 fluid ounces, 64 to 72 fluid ounces a day is optimal. Another big thing is you kind of asked about age and age and when this starts happening. So mobility is huge. You know, if you move, your gut will move. So make sure you're doing exercise, walking around. You basically don't want to be a couch potato, because then your gut turns off, and then that can cause issues and constipation. So you just want to make sure you're continually moving. You know, and I'm not saying, you know, go out and run a marathon or something, just walking every day, getting up, you know. So you guys are quite motivated because you're here today. So I already see that.
How much walking?
How much walking? Oh, geez. I'd say anything is better than nothing at this point.
Right.
So I would say that's always my mantra, is to, like, you know, some people get turned off by saying, oh, well, I can't work out today, I might as well just take today off. Well, I would say 10 to 15 minutes of walking or doing something is better than not doing it. So just a little bit of something every day is what I would shoot for.
Commercial break, walk around the coffee table a few times during coffee break.
Yeah, there you go. Yeah. And then the last thing is to just respond to the urge to go to the bathroom. I don't know, this is kind of a weird You know, I don't know how many people withhold going to the bathroom. I guess if you're on a long trip and you just got to go to the next restaurant, that's the only case I can think of, but. I guess there are some people out there that avoid going to the bathroom for whatever reason, so don't do that. So, practical pearls for constipation are kind of the take home messages. It's multifactorial, you know, exercising correctly, eating right, drinking water. Preventing it's easier than treating it. If you start having constipation, I would see your doctor to see so they can review your medication, see if there's a medication causing it. And then obviously the big thing is monitor for red flag symptoms. So if you're having severe abdominal pain, you can't eat anything, can't keep anything down. You're having fevers, chills, nausea, vomiting, etc. That's, you know, the indication to, you know, go to the emergency room, go to the hospital, get evaluated, because that could be indicative of a bowel obstruction or like an impaction that's now backing up severely, causing possible sepsis and infection. So that's something to not ignore. So. I'm gonna turn it over to Elena.
And are nuts considered fiber?
Nuts, fiber, I don't think a whole lot, no.
Mm-mm.
What's the difference between, you know, cause I just feel like, you know, nuts are, I don't know, what makes, like the bread that you said and those things, what's in them that makes those high in fiber?
So just what it's made out of, so like white bread is just like plain flour, and like wheat bread and whole grain bread is made with like the whole grain.
Right.
Yeah, so it's made with like the whole, you know, the whole shebang, which makes it not digestible, makes it fiber. So basically what the ingredients, so what it's made, oatmeal is oatmeal, so like the whole, you know.
None of this, I don't like.
Mhm.
No.
So what I think of when I think of, when I think of fiber, I think of the stuff that supports a plant.
Mhm.
Like gives it kind of that, like, you know, how a tree can stand up tall, or like, you know, pieces of lettuce they have like that fibery substance. It's the thing that makes it hard to be able to stand up. Our body can't fully break that down well. It can break down some of it, but that's why it's fibers, because it's not fully able to break it down. It's like that's the plant parts that I think of that really, maybe if you're thinking of like the skin of an almond, or maybe sometimes the skin of a peanut, maybe that counts, but I'm not really thinking that that's fibery, which is, I think it's more fats. I think we think of good fats coming from nuts, not like you can't eat nuts, I just don't think they're gonna be high in fiber.
Mhm.
I'm thinking of like your fruits, your vegetables, and I'm talking about like fruits with the skin on them.
Yeah,
Your
fresh
vegetables,
fruit.
yeah, fresh fruits. Not like frozen can't be good, but I feel like the freezing, it kind of breaks it down a little bit too, so it's like. Oh, yeah, it does. Oh, yeah, the crunch celery.
What about bananas?
I feel like there is probably some, but not as much as if you're gonna go eat like a peach or an apple. Oh, apples are a lot. I feel like the more crunchy something gets, the more fiber it has.
And that was more potassium.
Mhm.
Which we also gotta keep an eye on if we've got other conditions, so.
Yeah. If magnesium, another one I heard lately, they're making a big press on magnesium
In regards to what?
for normal health.
I mean, we all need a good balance of all of our vitamins, minerals, and
Yeah.
things like that,
So
so.
we still go by the pyramid?
No, we don't go by the pyramid anymore. They actually phased it out in like the early 2000s to the My Plate. They changed it to My Plate. So it's a bit easier to see. You can see a normal, I think it's an 8 or 10 inch dinner plate. They got it divided into kind of quarters, but your vegetables and your fruits are gonna be a bigger portion. Your proteins are gonna be a bigger portion. Then you got smaller portions of like, your fats or your carbohydrates. So like your potatoes, your things like that. And then they got a cup of milk next to it to
Okay,
get your
say the
dairy in.
name of that again?
My Plate.
My plate.
Yep.
Okay,
Yeah, so that's the general guidance anymore.
okay.
Yep.
If your vegetables are overcooked,
Mhm.
did you lose the fiber?
I feel like, yes, you lose some of it. Again, some's better than none if you need to have your fruit or I should say your vegetables cooked a little bit more to be able to consume them or eat them, because you just don't like the flavor of them. I feel like you're gonna get some fiber still. It might be a little bit mushy, so you're not gonna get all of the good benefits of like a nice fresh fruit or vegetable, but yeah.
But you're losing more of the vitamin.
Yeah, sometimes it really, yeah, it just depends. Yeah, so if you're like steaming a vegetable, that's gonna be better than like pan frying it.
Yeah.
Mhm.
Cause you're still gonna get some nutrients left over. They're still gonna have a little bit of a crunch to them rather than just being
You
mush.
can boil the heck out of them and then the vitamins go down. The
Yeah.
healthiest thing in your house is your garbage disposal.
Right? And then it also matters what you put on them too, right? Cause like you can have some really good steamed asparagus or that's like, not got a nice coat of like garlic salt, but if you slather American cheese on it, it's like, well, what's the point? So
Well, you still get your fiber though.
you get your fiber.
Fiber, but.
Yeah,
If I bring your trans fats.
yeah, you get the bad fats that way sometimes, but
The
yeah.
cheese is all bad fat,
No, not necessarily, it just depends on the cheese.
Yeah.
but it's protein too.
Yes, it does have protein. Yep, like if we're thinking about Parmesan cheese, that's really high in protein, but it also can be high in salt. Another thing about cheese is it can be high in salt too, so all the fun things you gotta think about. Yeah. I will turn it over to the over-the-counter medications. If anybody else has any questions, I can answer them now. If not, we'll move on.
Where are we on our?
Yep, that's good. Good point.
Yeah, may I have one of those papers? I spill coffee all
Yeah.
over mine. When you said, pain medicine,
Uh-huh.
you take ibuprofen, is that considered, something that causes constipation?
Not typically. We're thinking of like the prescription
I
medication.
don't think you.
We have multiple, yeah.
We're thinking of like the prescription, really strong pain medications for like after you get out of the surgery, something like that.
Okay.
Ibuprofen, we don't recommend generally for our patients above 65. It can cause fluid to get built up in the body, which can increase your blood pressure typically. It also can increase your bleeding risk. So we generally recommend like acetaminophen or Tylenol for patients above 65.
And they don't increase your bleeding risk?
Tylenol does not, no. Ibuprofen does. Those NSAIDs is the kind of class we talk about.
Doesn't
So
work as well.
yeah, I know. Yeah, so naproxen or ibuprofen are the ones we think of over the counter. We don't want our patients.
You've got that ibuprofen that you're taking or naproxen regularly.
Mhm.
And they also have you on aspirin to thin your blood. Wouldn't that do the same thing?
Ibuprofen and naproxen, yes, they can thin your blood, but it's not studied like aspirin is. Baby aspirin does have its place where we have like our patients that have a heart history. Maybe they've had a recent heart surgery to open up the vessels in their heart. We need them to be on that aspirin, right?
Well, I understand that, but I'm saying in addition to, because if you were on it before and then they added the aspirin as well,
Mhm.
shouldn't you be on both then?
So that's again, it's like a risk versus benefit that you would have with the doctor. If you're taking the ibuprofen consistently over the counter, and they don't know about it, that could be something that they would want to know, because then they would tell you probably to stop taking the ibuprofen and to transition to something else a little bit more safe. Yes, they're both gonna increase your bleeding risk, and that's something, again, that way we don't want our patients above 65, especially ones that are.
On the cross.
Yep, same with naproxen. Yeah, we definitely want to, we prefer the aspirin, which has been clinically proven to help prevent, future events of like heart attacks, strokes, things like that. In our patients with that heart history, rather than taking the ibuprofen round the clock for pain. Well, so that goes with something else.
Age doesn't necessarily go along with my constipation, because I've had it ever since I was a child.
Me too.
And I've had anal fissures,
Mm-hmm,
making it, you bleed when you poop,
Sometimes.
mm-hmm,
because you're straining and it's so hard and big that it rips you open, basically.
right.
Anal fissures. I've had that since I was a child as well.
Mhm.
Now going into your medications that you have up here.
Mhm.
For me, it would have been much more beneficial for them to have put me on Miralax prior to surgery.
Hmm.
Because it took me over 4 days after surgery to poop, even on the Miralax.
Well,
And
yeah.
I'm already, but they never mentioned that, so
Yeah.
that might be something
And that's
that.
the thing too, you kind of stole my thunder, but Miralax takes anywhere from 12 to 3 days, 12 hours to 3 days to actually work. So, yeah, it kind of, they should have started you earlier on that.
Exactly,
Mhm.
because after surgery, they don't want you to strain,
Mm-hmm.
but yet,
But then you still have to have that bowel movement. If you're in the hospital before they'll let you out, they need to have you have that movement.
And it took 4 days.
Were you in the hospital 4 days?
Yeah.
Holy
Yeah.
cow.
after surgery.
Constipation, it affects us all at different times.
Yeah,
Yeah. So any other questions before I move on?
no, go ahead.
Perfect. So the first one I have is bulking agents. So this is what we think of our like our Metamucil, our Citracel. This is the fiber. This is literally, they have plant fibers that they make into this powder that you mix with water, usually 8 ounces. And then you drink it pretty quickly because if you let it sit in that water, it will start to get bumpy and gooey. And it's not fun to drink, and it's definitely not good for your bowels to have a bunch of bloop in there. So with that, it gets into the bowels, it adds bulk, and it softens the stool to make it easier to go. Take it with plenty of water. Again, constipation is pretty much a lot about that water intake. With that bulking agent and the osmotic agents, the number 3 Miralax, you're gonna wanna drink plenty of water. As well as the stool softeners too, the number 2. If you don't got enough water, these agents they're not gonna be able to work properly. And specifically with the bulking agents, it's just gonna create that gluey substance in your colon, in your gut. So that's why we need to get more water in there to make sure that it's moving along. That one can take days to actually work, if you're taking the recommended amount.
Talk about Metamucil, right?
Yeah, Metamucil.
Okay, takes days before it really kicks in.
Yep.
Okay.
Yeah, it takes days. And this one again is gonna be something you're gonna want to not go, like, I'm gonna drink 2 big spoonfuls of this every day. Like, no, we're gonna wanna slowly move up and work up, cause if you're not getting a lot of fiber and then you throw like 5 tablespoons of Metamucil into 8 ounces of water and chug that down, you might either have the exact opposite effect of what we want, or you might get more stopped up. Yeah, so you gotta let your body get used to the amount of fiber you're getting in. So then going on to number 2, the stool softeners, the mush is what we call this one. It makes the outside of the stool a little bit more soft. So that makes your body easier to pass it and push it out. Again, taking that with plenty of water because it uses the water from your body to make the outside of the stool soft. The example we have is Colace. This is pretty common. You can get it over the counter. Doctors prescribe this all the time to patients. The only issue we have with stool softeners is they don't really cause your body to move the stool. It just makes the stool softer. So this doesn't have like a time to, last time you use it to when you have your bowel movement like our other agents do. So just keeping that in mind, it's just gonna make it softer. That's why we call it the mush. Number 3 is our osmotic agents. This is the push. So this is that Miralax you were talking about. You're gonna take it, it's a powdery form. You fill it up to that white line in the cap and you dump it into 8 ounces of water, juice, coffee, anything that doesn't have bubbles, because then it's gonna get frothy and foamy. It's just gonna be unpleasant to work with. So put that into 8 ounces of water, drink the full 8 ounces right then and there after you mix it up. And that, again, is gonna draw that water into the stool, make it easier to pass. It's gonna make your colon pass it as well. So this one, like I said, takes anywhere from 12 hours to 3 days to work when you're taking it consistently.
Still takes a while.
Yeah, still takes a while. The last one we have is the laxatives. This is like our last ditch effort, especially for our patients above 65. This is the rush. Now, there's a bunch of reasons why we call it the rush. It increases your bowel squeezing. So not only are you gonna have a quicker turnaround time, it's usually about, I think, 6 to 12 hours from the last time you take it to when you have your bowel movement. But it's gonna be uncomfortable. You're gonna feel some of that cramping, that squeezing of your colon moving the stool through. So we're not gonna wanna take this regularly because not only does, it helps you move, sure. But your bowels can get dependent on it if you take it regularly, like every day you take a tablet or 2.
The uncomfortable part that you get, is that where like it rolls? It makes that rolling sensation in your intestines?
I usually think of like the sharp cramping is what I think of. It's like a sharp pain. Yeah. Yeah.
I don't think I've ever taken this.
Yeah, this is, again, our last ditch effort. We really don't want you to use this often, if at all. Another reason why we don't like our patients above 65 to use it is because if you gotta go, sometimes you're like, oh no, I gotta go, and you'll go rush and then you might trip. If you have something laying around out in the way of your walkway trying to rush to the bathroom, we don't want you falling.
Yeah.
So it's another reason why we don't recommend it. But our examples that we have Dulcolax or Senecot. Those are the most common ones you see. You can even get Dulcolax in a suppository, so something that you'll unwrap and insert into your rectum in order to get it to move faster. That one's gonna be pretty quick. That one's gonna be like a 30 minutes to an hour, pretty quick. But again,
Yeah, that's that long white capsule type thing.
it's almost like a greasy. It's not like a capsule, it kind of looks like a bullet. But it is white. Yeah, you'll unwrap it from the
I don't
foil.
need capsule, it mean like,
Two,
Mhm.
oh.
two, four.
that one.
Yep.
Yeah.
Yeah, so that one will work
They
really
have,
quick.
I don't know what you call it, film on them like.
Yeah, like I said, they'll
Like
feel a little
water-
bit slick.
Lubricant.
It's a real.
Yep.
Yeah, it's a lubricant of some
Yep.
kind, okay.
Yeah, so they have that as an option as well, but again, we're gonna want that to be the last thing that we reach for.
Oh, no kid, okay.
Yeah, just because of the complications that can happen from it, and we don't want you to use it every single day.
Yeah.
Cause then after you stop, say you've used it for like a month or two, and after you stop, sometimes you just will get constipated because your bowels are so used to constantly having something saying, hey, go, 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 so. We don't want you to use that one as often. It probably is between the bulking agents, number 1, and the osmotic agents, number 3, that we would recommend for most of our patients 65 and up.
What about that oil that's in that same section of your,
Are you talking about glycerin or
oil, there's no flavor to it or
Mineral?
taste to it, yeah, that.
not recommended at all for anybody above 65? Could choke on it, could get aspiration pneumonia from it.
Oh, wow.
Don't recommend that at all.
I'm not 65 yet, so I can't use it.
I mean, anybody, once you start getting older, I mean, there's always that chance. Yeah, it works, but I worry about our patients
I
getting
never
that
knew that.
pneumonia. They don't recommend that at all.
Yeah, I usually drink it right out of the bottle, so for thing,
I'll pretend I didn't hear that.
Yeah.
And then the last one, again, talk to your doctor, especially if, like Dr. Kaminsky said, if the constipation's new for you, if there's blood in the stool, that can be bright red blood, or it could be dark, like coffee grounds, it looks like, because that could mean that there's a bleed up higher in your colon. Yeah, so keep an eye out for that. If you notice again any changes that makes it darker, definitely want to talk to your doctor. If you're having severe pain in your stomach, whether or not, like, it's like, if you're going, obviously, if you have that sharp pain in your stomach, we're gonna want to talk to the doctor. Even if you're not having those often bowel movements, like less than 3 in a week, and you're having sharp pains, definitely talk to your doctor. And then again, if that constipation, if you're using these agents for 2 weeks, that's gonna be our max. Then you're gonna want to talk to your doctor. If it's a constipation that's lasting longer than 2 weeks, get a hold of somebody, whether that be your family doctor or someone to help you out. If you have a GI doctor, you can talk to
so I
them as well.
shouldn't be doing Docola or that Miralax all the time then.
If you've been prescribed it by a provider and they say that it's okay to use daily, then yes, but if you're using it over the counter, definitely not every single day for 2 weeks or longer. Don't want to do that.
Yeah, it sounds like the Metamucil would be the thing to use every day.
Yeah, honestly. Another thing to keep in mind with the Metamucil is that if you have diabetes, Metamucil, the original, has sugar in it. So you want to get the sugar-free version.
And why would that be? Sure, certainly would taste better with sugar.
No, honestly, I've tried the sugar versus sugar-free. Sugar-free tastes just as good.
It just-
It does, honestly. Yeah, I will admit. They got an orange flavor too.
I like use sugar.
All right. Well, thank you for your time. Hopefully you found this to be informative. Next month, our talk is on hearing and vision loss. But appreciate your time. Wish you a happy, healthy month, and we'll stick around for a couple minutes in case you have any personal questions. But thank you.
Got another main question. Have you ever heard of anybody having constipation and